Hold on, let me go back. Okay. What are teratogens? Teratogens are environmental agents that interfere with normal prenatal development. And the most talked about and the ones I wrote about are alcohol, nicotine, illicit substances, and heavy metals. Teratogens pose a significant threat to normal prenatal development, with consequences that can shape physical, cognitive, and emotional functioning throughout the lifespan. Although their most immediate effects occur during gestation and infancy, many teratogen-related impairments persist into adolescence and childhood. Understanding these lifelong influences emphasizes the need for education, early detection, and supportive services that continue well beyond childhood. By strengthening prevention efforts and offering comprehensive interventions, society can significantly reduce the long-term burden of teratogen exposure and improve quality of life for everyone. Alcohol is one of the most widely studied teratogens, and prenatal exposure can lead to a spectrum of disorders, collectively referred to as fetal alcohol spectrum disorders. And I like to touch on this one because I've really seen it like firsthand. My cousin, my aunt and uncle adopted him, and he was born by his birth mother was an alcoholic, and he was born with a tongue tie or something like that. And he also has like a lot of mental disabilities. And he's a good kid, but he didn't ask for that. But he's got a good family now. Okay. Neurobehavioral symptoms, including irritability, poor feeding, and difficulty soothing, often appear shortly after birth, demonstrating the immediate consequences of alcohol interference with fetal development. Nicotine crosses the placenta easily, restricting blood flow and reducing oxygen available to the developing fetus. These effects frequently result in low birth weight, prematurity, and problems with lung development. Smoking during pregnancy also raises the risk of placental abruption and SIDS. The teratogenic influence of tobacco is not limited to structural issues. Research suggests that the prenatal nicotine exposures alters fetal brain development in ways that predispose children to attention difficulties and behavioral challenges later in life. So, I don't know because I wasn't born, but that's probably wrong with me. That's probably what's wrong with me. Because I'm pretty sure that my mama smoked with me. Okay. And now it gets a little deeper with the illicit substances. All the things: cocaine, meth, opioids, heroin, fentanyl. We see it's more prominent now because I work in the EMS field. I just see it a lot. Everybody's on fentanyl or meth or both. But these early complications often require specialized medical care, but can also signal the beginning of long-term developmental challenges. I know a lot of times the baby is born with they're addicted to, so they immediately get they'll probably have a seizure and they get seizure meds as fresh out the womb newborn. And what I did not talk about on my paper was stress. and I didn't even know this until I was researching it some more yesterday. So stress activates the sympathetic nervous system and releases catecholamines, and there is a bunch of hormones that it releases, but catecholamines is the main one. And when the mother stresses too much, the placenta becomes less effective at blocking these hormones, therefore harming the baby. It stresses the baby, like everybody say. Okay. Have a great Christmas break.